All right, so welcome everyone to the Hemophilia Council of California's Advocacy and Policy webinar. My name is Elaine Kintz. I'm the Executive Director of the Hemophilia Council of California and wanted to welcome you to the California Children's Services What You Need to Know webinar that we are hosting this evening.
Ooh, so what if I get a bill? So you should not get a bill if your child has an active CCS case. You should not get a bill for the CCS condition. So if you do get a bill, it could be a mistake. And so don't pay it, but call CCS right away because time is of the essence with these. We have no way of knowing that the service didn't get paid for because we're not a part of that system at all. So don't assume that, we know that something happened and we're correcting it behind the scenes. The only way we will know is if you call us and tell us. Let's see. Yeah, and we don't want any bills to go into collection. So that's why as soon as you get that bill, give us a call so we can get to work on it. Okay, how do you renew? So typically the county will notify you by mail when your eligibility is up for review or renewal. But it's good for you to know when your child's annual renewal date is, and you can contact the county to ensure there's no lapse in eligibility. And all the same documentation is required each year. But once again, if your child has full scope Medi-Cal, we don't really need any additional documentation because we can use what you already submitted to Medi-Cal as your documentation. So again, I'm seconding what Lynn said with the end of the public health emergency and Medi-Cal redeterminations going back into effect. If your child has Medi-Cal, make sure that is in place and then CCS will follow. Let's see. Common causes for delays in enrollment or in renewal. So a lapse in Medi-Cal coverage will cause a problem with your CCS. So your CCS, if your child has Medi-Cal, your CCS really only works if that Medi-Cal is active. Missing verification of proof of residence. So if your child doesn't have Medi-Cal, making sure that you get that annual paperwork in, like the proof of residence, is really important. Same with the verification of income. Keep in mind that if sources of income have changed since last year's taxes, that should be documented and included, and any pending Medi-Cal eligibility. Let's see. Okay, and what to watch for. So you'll get a BIC card in the mail. And you'll get a BIC card in the mail even if your child doesn't have Medi-Cal. But if your child gets CCS, you will still get this BIC card, which looks like a Medi-Cal eligibility card. And so that can be confusing because it looks like your child has Medi-Cal, even if your child does not have Medi-Cal. So if that's your situation, like your child doesn't have Medi-Cal, but they do have CCS, just know that that card is only good for covering services related to the CCS eligible condition. And I think we're coming to the end here. So If you need any help, any questions, contact your local county office for more information. And again, I believe that link to the list of county offices with their phone numbers is being put in the chat. Or you can call the Hemophilia Council of California there, or email in.
I think we can probably switch over the provider information. I think most of the providers know how to get a hold of us if they have questions. I do want to briefly thank all of our sponsors that make this webinar series possible. We have Takeda, Sanofi, BioMarin, Novo Nordisk, Pfizer, the Hemophilia Alliance, and CSL Behring, who help support these presentations. So thank you so much, Meredith, for your time. Again, if you guys have follow-up questions or like specific individual situations that you need assistance with, don't hesitate to reach out to us. And Meredith is specifically there in Humboldt County, but sometimes if I get a particular sticky CCS question, even if it's in a different county, I will call her, and she knows a lot of folks in other counties too, so she can help. She helps us navigate those on occasion. Thank you so much for joining us. We'll see you next month. Bye-bye.